Meantime, a new startling model released by the Oregon Health Authority today says if COVID-19 continues to spread at its current rate, we could see as many as 570 new cases per day. Fox 12's Drew Marine spoke with a doctor who has worked with COVID patients, plus a local woman who was one of the first from Oregon to experience the virus herself. Drew?
That's right. Both of them say that the trends reported by the Oregon Health Authority are concerning, and everybody needs to do their part, especially this winter, to make sure things don't get worse.
I feel completely lucky and extremely grateful that it wasn't worse.
Rebecca Frazier had COVID-19 at the beginning of 2020. She was on the Diamond Princess cruise visiting Japan and tested positive before eventually coming back home to the United States.
Just a dry cough, like not a hacking cough, not a productive cough or anything, just like a tickle in your throat.
She says when she got the positive test, she was shocked.
I felt okay and was still positive for it. So it goes to show that even if you don't feel ill, you may still have been exposed and could be spreading the virus unknowingly.
That's what worries her about the Oregon Health Authority report released Friday. The OHA says if COVID-19 continues to spread at its current rate, we could see 570 cases a day with 40 hospitalizations. And in a worse scenario, as many as 740 cases a day with 48 hospitalizations.
For me, it's honestly been kind of frustrating. I feel like we could be doing a lot more to reduce the spread than we are.
Dr. Nick Cashy, a primary care doctor with Legacy Health, is also concerned about these trends.
Flu season is always a strain, for our health season every year. So to have an additional load or an additional number of patients admitted with COVID is really going to could significantly put a strain on our resources.
He says this possible upward trend is especially concerning because he's seen firsthand what this virus can do to people.
People can wind up in the hospital on a ventilator, really unable to breathe. When somebody is dying, they're often dying alone or just with a single person, and that can that's been one of the really most heartbreaking elements of how this illness has taken the lives of Americans all over the country.
Of course, both of them stress the importance of wearing a mask and social distancing. Cashy says this is the best way to prevent the spread of COVID-19. Live in North Portland, Drew Marine, Fox 12 Oregon.